So welcome. We are here today to have a quick conversation regarding the church and what that means for us in ministry with the pandemic, COVID-19. My name is Chris. I'm a local pastor with United Methodist Church. I'm bivocational. And one of the things that means is I get to work with cool people like the other person you see on the screen here with me. This is Dr. Neil Lamb. Dr. Neil Lamb is the Vice President for Educational Outreach at the HudsonAlpha Institute for Biotechnology. And aside from just being a brilliant scientist and educator, he also is firmly rooted specifically in the Methodist world. So Neil, Dr. Lamb, do you mind telling us just a little bit about that?
Yeah, sure. Thanks, Chris, and thanks for the opportunity to be here and to be part of this conversation. So my background's in human genetics, but after I got my PhD, I was called for a couple of years to work in a local church in Atlanta. It was a really strong calling to step into a specific area of ministry at a specific time, and then God opened a door for me to head back into academia, and I'm a human geneticist that's focused on science education and communicating complex topics in the field of genetics.
Excellent. Well, thank you for taking the time to be with us today. One of the reasons for this is to kind of have a pastoral / scientific discussion on what this means for the church, especially as pastors, as we're making decisions. Easter is here. It's not a convenient time for this to happen, as if any time is convenient. But we're getting a lot of information from a lot of different sources. Specifically in the Methodist Church, we have information coming down to us from our leadership, but then there's also outside sources as well. Can you tell us just a little bit about what we should be looking for in our information sources as we're trying to make decisions regarding our church and its health and safety?
Yeah, Chris, I'm going to not step into the kinds of sources that you're getting from your pastoral leaders. I'll let each of the pastors, follow the guidance of their church and their district and their conference leadership. But from a scientific perspective, the virus isn't the only thing that spreads rapidly in an epidemic. Misinformation is everywhere, and you and your congregation are probably seeing a lot of this. It's coming in their Facebook feeds or Twitter. And I would just encourage you to go to a handful of sources that you trust, like the Centers for Disease Control, the World Health Organization, or a major newscaster, either in online, print, or video. Be really cautious of what you see coming into your Facebook feeds. And if you aren't certain that it's the right content, then do some follow-up and some checking.
Okay, so because of this virus, we have made a lot of changes to how we do things. And I know there's several of us out there in the ministry side of things that don't have a scientific background. So can you just very quickly orient us to what this is? Why are we canceling our services right now? Why are we telling people to stay away?
Sure. So COVID-19 is an infectious disease. It's a respiratory disease, upper respiratory initially and then lower respiratory. It's caused by a virus called SARS-CoV-2. It's a member of the coronavirus family. So this is a virus that humanity has never seen before. None of us have any immunity against it. It is more infectious than the flu. It has a higher rate of severity of landing people in the hospital and in intensive care and of death than the typical seasonal flu. And individuals can harbor the infection. They can be infected by the virus and infect other people even if they have no symptoms, and the people they infect can become incredibly sick. So that concept, it's more infectious, you can have it when you don't have any symptoms and pass it on, and it has a higher rate of severity of symptoms, is really what has led to this push to social distance, to minimize the number of times when people are together in groups so that we can slow the spread. We can do everything we can to prevent it from infecting other individuals. So we minimize the number of people that get infected, and then that means the number of people that have to go to the hospital and the number of people that have serious cases or that pass away.
So right now, we're not overplaying this. Right now, canceling the services that we have or moving online, not necessarily canceling. But that's, so in your view, that's really a right move for right now.
It is. From a scientific perspective, we need to do everything we can to keep our congregation out of the hospital and to minimize the number of people in our community that end up in the hospital. Because if our hospitals are overrun with people with coronavirus disease, that makes it really hard to treat people that need to be there because they're having babies, or because they need to have surgery because they've just had a heart attack. So I know this seems extreme. None of us have ever done this in our lifetime, but social distancing and minimizing the chance for the virus to spread is key right now.
Okay, so let's get real for a moment, right? Because ministry, it never stops. People's lives keep going. For those of us who are in ministry and we've got people in our care, in our congregation, that are, say, end of life situations, right? So due to sickness or hospice has been called in, how can we, is it safe to go and to minister to those folks? Is it safe to go knowing that, you know, it's really tough when somebody is at the end of life and they're requesting you to come over, right? Pulling back and saying no to that is, as a minister, that just pulls at everything that you are, right? To have to say no to that. So can we say yes? What should we be looking for in making those decisions on taking care of our folks?
So I think it's important to recognize that social distancing doesn't mean social isolation, that there are still opportunities for you to engage in ministry and care for one another. I think the first question that I would ask is, are there ways that you can do it without being in person at their bedside? And if so, if there are family members that are already there that are social media savvy that you could work with, if you could do it by phone, I would encourage you to go down that road first. Are there ways that you could consider having a conversation? If you've got to be there, could you be there with some distance? Could you be at the doorway instead of at the right next to them? You want to think about, how do I stay 6 feet away? How do I avoid any respiratory droplets that may come out of their mouth when they cough or sneeze? And in the same way, how do you keep from infecting them? Because if you're going to multiple people, you are a vehicle for this. So how do we minimize the number of contacts? If we get to the point where this is an individual that has COVID-19, I think at that point, you need to be working with individuals that are specialized, that have specialty training in going into these situations, and put that in their hands. I know that is hard, but I'm willing to bet very few of our pastors have a lot of experience full suiting up in personal protective equipment and going into an infectious space. Hand that responsibility to somebody that does that on a regular basis, and see if there are virtual ways that you can make those connections.
Okay, so just to kind of push that forward, if we get to the point where we have funerals, either COVID related or not, that need to be officiated in our particular context, is it safe to do that, or do we need to find creative ways to have that funeral, or wait till this is all over with, or what should we be doing about that?
So some of this is probably going to be driven by the funeral homes in your community and the cues that they are taking from their leadership. They may go to an all online funeral. I think the idea of having a traditional funeral where we have dozens of people all gathered together in the same space is not what we want to look at right now. We've got some examples in other parts of the country where that was the way that the virus widely spread, because everyone came together for a funeral. I think that different groups are going to have to make some different decisions. If there are ways you can do that virtually, if there are ways that you can do that where there are a very small number of people that are present in person and they're all practicing social distancing, this is hard. I know that we are giving directions to people that their first response is to rush in and to embrace and to be powerfully present. And we're asking them to find ways to do that with some distance. That is really hard, but you want to minimize your contact. You want to minimize your exposure. Let me say that differently. You don't want to end up becoming infected and infecting other people in your congregation. So how can you provide the best support and care and encouragement in ministry, but do that in a way that minimizes exposure?
So I'm really hearing a Wesleyan theme from you of do no harm.
Yes, I think that's right. How can we find ways to be caring, committed? How can we be salt and light? How can we bring compassion and peace and love? But how can we do that in ways that does not expose other individuals to risk?
So a big thing is happening in the next week.
Yes.
May have heard of it, called Easter, right?
I am familiar with Easter.
So Easter is traditionally a time that we go all out, right? We are trying to bring the community into the church. We're trying to minister in new ways. We're trying to find new and creative ways to tell a story that is impactful and brings each and every one of us life, right? So again, how do we do that in light of COVID-19? I know that some creative things have been thrown out there, like a drive-in church, for instance, right? So everyone gets in their cars as a family. You drive to the location, either the church or a parking lot that's separate. Perhaps you have an FM transmitter and you're transmitting to people's cars. Things like that. They are inventive, creative, yes. But I guess my question to you is it safe if we come there versus, do we have to tell everyone to keep their windows rolled up so they're completely isolated when they're there, or to keep the car 6 feet apart? Or is that something like that? Is it safe for us to do?
It's a great question. Holy Week is something that we experience corporately, whether it's the crowds of people lining the streets waving palm branches, or it's Jesus gathering with his disciples at the Last Supper, or praying in the garden, or the celebration of Easter. We have historically done it corporately in gatherings. And that is really difficult to think about. How do you do that? How do you share that experience corporately, virtually? What does virtual corporate look like? Drive-in church. I think the first question you need to recognize, or the first top piece, is that there are rules and requirements by the FCC that you have to be aware of. Do you need a license to be broadcasting over an FM station? And you want to make sure that you don't wind up doing something that is potentially going to be problematic or have to be shut down. So make sure you're following all those rules and regulations. Drive-in church. If you've got people that are part of a family that are together every day and they go to an event and they only participate with themselves and not interacting with others, there's potentially less risk there. But again, are they picking up a shut-in on the way? Are they inviting other families? Are they sitting in the pickup truck and they're bringing other people to sit in the bed of the pickup truck with them? All those things are increasing risk. So if you can find creative ways to minimize risk that people can still participate corporately, I think that's what you want to try to find. And I recognize that's hard. Drive-in church is an option if you've found all the ways to minimize all the other risks and are doing something in accordance with the FCC.
Okay, so let's say we want to do something for our church, specifically say our children, right? And we want to prepare small Easter baskets or little bags of goodies to take to the homes of our congregants who have children. Is stuff like that safe for us to be able to take items, put them together, and then distribute them, even if we maintain social distancing while distributing, right? So even if we don't come into contact or any closer than 6 foot with the people we're delivering to, is something like that safe, or do we need to even reevaluate something like that?
This is a tricky one, Chris. Not that the other ones haven't been tricky either. But the advice that people are giving is when you go to the grocery store, you should behave as if everything is contaminated. That does not mean it's contaminated. Let me be real clear. I'm not trying to instill fear in going to the grocery store. But we know from some science data that the virus can live for a number of hours, and in some cases for a number of days, on steel and cardboard surfaces. And so if someone's been to the grocery store before you and has coughed, and they have the virus and they've coughed onto a can lid, and you come along hours later and pick it up and touch it and then touch your face, you now run the risk of contaminating yourself and infecting yourself. So I think that advice of treat everything as if it could be contaminated and take appropriate precautions is also going to apply in this setting. Having a group of people get together and put individual packets of things together for kids has some real challenges around that. Can you provide appropriate guidance that when you bring this into your house, you need to wipe off every surface and before you open up those sealed bags? I think, are there ways that you can creatively ship stuff direct from a warehouse to somebody instead of I'm going to prepare this in my home and bring it? This is challenging. If you're going to do something like that, make sure that you've got clear guidance to help people think about, how was this put together? How do I need to bring this into my home? How do I need to behave? And how do we do that in a way that doesn't make people fearful? Easter is about conquering fear and conquering death. And the last thing we want to do is create a set of circumstances and situations where people are now even more fearful of what has been brought into their home.
Okay, so I have a follow-up question, but before I get to the follow-up question, just a little behind the scenes, I have been working with Dr. Lamb on some video projects where one of those episodes actually goes into what he was just talking about, goes into how long the virus can stay on surface and the studies that are happening with that and how it's transmitted. So if you search shareable science, you'll see those videos come up. And if you want to get to a little bit more of the scientific side of that as well. But just a follow-up question. When it comes to distributing items, many of us right now are figuring out how to distribute items to those who are in need. There's so many people who are hurting financially, lost jobs and such. So do those same things apply when it comes to distributing food? Are we okay to distribute food? Because obviously people have to eat. And if there are people in need and they have no other way to get it, then if we're the only lifeline, what things should we be taking into consideration when it comes to benevolence ministry and feeding those who are needing it right now?
I think it's important to recognize that people come first, that we have needs in our community and that we need to meet those needs. And this is not about saying don't do that, don't meet the needs of people, but try to find ways to do that minimizes exposure. And it may be that there are groups already in our pastors' communities, food banks, that are already doing this. And so rather than creating an additional opportunity that runs the risk of an additional set of exposures, maybe your congregation partners with an existing group that's already doing this. So you're stepping into this support. I think those are the kinds of ways we can meet the needs of the least of these around us, and also do it in a way that isn't introducing unnecessary risk.
Okay, so we've stayed fairly safe. Let's jump into some murky waters here for just a moment. Communion, right? That's a hot topic for many of us in pastoral ministry right now, because obviously we can't meet together to do that. I know there was some guidance that was given. I don't know if it was recent or if it was something that reemerged from the Council of Bishops regarding online communion and how to deal with that. I know for us pastors, it would be helpful to look at that and to see what our DS and bishop are saying. But when we attempt to do online communion, whatever form it is, if we attempt to do that, what are some things we need to take into consideration, because I know that the go-to is in situations like this is the prepackaged communion, right? The one that had the cup, and the one in seminary that we always, kind of joked on because of the theology of consumerism. Right. But they're very valid right now, right? That's helping a lot of us, but they're also out of stock in most places. So I know some churches have attempted to pull together communion elements to do a small home care package. Some people have just simply said, go to the store and get the bread and the juice and bring it home with you, and then be prepared for Sunday. When it comes to online communion, scientifically, not from the theological perspective as much, but scientifically, what do we need to take into consideration when it comes to asking people to get elements versus having it prepared to come by the church and pick up, or what should we be looking for?
I think you want to minimize the number of hands that have touched and the number of lungs that have breathed over whatever it is you're going to have people then take as communion. So that being said, someone going to the store and buying elements and bringing them into their home and then opening up and cutting lots of pieces of bread and pouring lots of little bits of juice, that is another set of exposures, as opposed to what do you already have in your home that doesn't require you to make a special trip. Now, I also get you've got shut-ins and you've got people that can't go and get. And so again, people come first and their needs. But I think from a scientific perspective, you want to minimize the number of exposures that bread and that juice has had. You want to minimize the number of different people that have touched, breathed on it, potentially coughed on it. Again, a reminder, you can be infecting other people right now with no symptoms. And that's not meant to scare people, but you think, oh, I don't have any symptoms, I don't have any exposures, I'm safe. We cannot guarantee that that is the case. So I think we just have to be extra vigilant here.
In your mind, is there a cutoff point that we need to be prepared for? So let's say I found out that, just making this up, right? But let's say I found out one person in my congregation was not only exposed, but also tested positive for COVID-19. If I've had contact with them in the past 2 weeks, do I, as a pastor, now need to go into self-isolation? Or is that entirely driven by, if I'm not sick enough to go to a doctor, then I don't have a doctor's order, right, to self-isolate. When it comes to ministry, though, if I go into the church to prepare for online service, at what point should I be considering self-isolation for myself? Like the degrees, I don't know if that makes sense, but the degrees I need to be looking for there of distance.
So,
and I'm sorry, by degrees of distance, I mean degrees of
right.
distance from people who have tested positive or have been in contact.
So Chris, I think that's an excellent question. If you have someone that you have been in close contact with within the last 14 days that either has symptoms and is unable to get tested or has a positive test, then you need to self-isolate yourself and monitor for symptoms for 14 days. If you were at a gathering where someone was and you had very little contact with them, this is where it gets tricky. I think you need to be very aware of watching for symptoms. And I think you need to give some serious thought as to whether you isolate yourself or not. Notice I didn't say you should isolate yourself, but I think you might need to think about, do I need to go into this person's home, or do I need to go to this gathering of 4 people, or those sorts of pieces? That brings it close to home, doesn't it? Mm-hmm. And I know that some of our healthcare centers are making the distinction between high contact and very minimal contact, and as they try to make decisions about who can continue working, both groups need to be self-monitoring, but high contact probably needs to withdraw. So I think that's a fair metric for us to be thinking about.
And I would like to also just throw out the disclosure at this point that everything we've been talking about is obviously from a scientific perspective, but it's not necessarily medical advice that we're trying to give out. So I think we need to make the disclaimer, see your physician.
Yeah, I think that's a great point. I have a PhD after my name, not an MD. And so we need to, when you have health-related questions and concerns, you need to refer them to your physician, not based on what has come out of my mouth.
Well, what you have said is incredibly good. Thank you for taking the time to do this. I wanted to talk with you because I am fortunate enough to know you and know your heart and know that you have the science, but you also have the love and know how to care for people as well. And so we thought this would be a good bridge to kind of talk through some of these concerns that pastors are having to go through. Because like you said, none of us have gone through this before. It's uncharted territory from all of us, but it does offer, new opportunities for us to be creative in our ministry, to really find new context or be in a new context, to find new ways to show love and care for people. I was kind of thinking through all of this, and I think I mentioned to you this morning that the term ecclesia kept coming up in my mind, right? Which coming from the Greek into English translates as church. But ecclesia was originally a gathering in underneath Roman occupation of citizens, right? It was a town hall, if you will. And I love the fact that Paul subverted that term to use it for the church, to say in this context, even in the context of Roman occupation, we're going to find ways for the kingdom to burst forth here. This is now a place where it's going to happen in this context. And so in this context, one of the things that I know as a pastor, I'm asking myself is, what new ways can the kingdom burst forth and right here, even being where I can't physically go and have contact or have Bible studies or church services, or what new expressions of love can we show? And so thank you for your time and helping us figure that out. Do you have any other thoughts as we wrap this up?
Thank you for asking me to be part of this conversation. I think that pastors have the opportunity to be a calm voice, to help their congregation work through their anxiety, whether people in your congregation are healthcare workers on the front line, or their parents who are concerned about the health of their kids, or their individuals concerned about older parents. Pastors have an incredible opportunity to be a voice of reassurance and calm, and to direct people to fact, not myth. And as we step into Holy Week, the beauty of the crucifixion and resurrection is that the worst thing is never the last thing. And I think that message will resonate with a lot of people who are living in fear right now and looking for hope. And that is the message of Easter is hope. So I think, as you've said, there are great opportunities. They're out of the box. They're different. They're not going to be the traditional way that we've done this before. But the need is great. And the message of Easter resonates in so many ways for this. So I appreciate the opportunity to have this conversation and to be able to talk about these topics.
Well, as we attempt to be that calming, reassuring voice as our congregation figures things out, thank you for being that voice for us today and for helping us work through that. We really appreciate it.
My pleasure.
Excellent. Well, thank you, Dr. Lim, and we'll talk with you soon.
All right. Thanks, Chris.
All right. Bye-bye.
Bye.